My name is Nshemeire Gwaku. I work at Private Sector Foundation as the Chief Operations Officer. So I'm happy to be here. It was a great conversation today, and I loved the subject, social protection. We still have a lot of vulnerable gaps, gaps in the social protection space, and I think everyone has a role to play. It's not that one entity alone will fix it. We need to work collaboratively. So as the private sector, work with government, work with civil society organizations, work with the policymakers in order to transform our situation. So I think for me, looking at the journey so far, there are several milestones that I'm very proud of when it comes to the private sector's role. The fact that we've got a decent number of companies that are paying pension for their employees. The fact that, and I think as a learning from COVID, that more private sector players are valuing medical insurance and therefore making effort to pay that. Some are paying group personal accidents for their employees. Those who can't afford the medical maybe will pay the GPA. You have those that are going the extra mile to provide wellness programs for their employees, which is fantastic because our statistics in Uganda are worrying. We have a 46 million population, of which 23 million are women, and of which 10 million are the youth. We've got numbers from Uganda Bureau of Statistics that say that 56% of our population is not employed, not in education, not in training. And that is about 25 million people. So when we talk about vulnerable people, already you can see we have a huge challenge to work around. But also we can look at it as opportunities to innovate. I think for me the other thing that we have to be conscious of are the refugees, are the 1.5 million people, and the 12% of our population who are the people with disabilities. So even as we get into the policy, into the intervention conversation, these are the numbers that we need to stick somewhere on a wall and keep looking at and saying, how do we transform these people's lives? And I know the conversation today was, it's not just the poor that are vulnerable, it's not just the disabled that are vulnerable. Everyone is vulnerable. You can become vulnerable overnight even though you're very comfortable financially. And I think it's important that we make sure everyone is protected, and if any shocks come through, we can bounce back. So what are the areas that I look at where we can collaboratively find solutions? And one of my first recommendations is innovation. Innovation, it's a recommendation, it's also a takeaway from there. Even as I listen to everyone, we need to innovate. If I look at what private sector, in collaboration with government, have done, for example, in the telecom space, the government has provided an enabling environment for the telecoms to thrive. The telecoms have driven financial inclusion significantly. We have 34 million people on mobile phones. They are borrowing, and therefore the telecoms have a credit history. So if I've been borrowing 50,000 every day and I've been paying back faithfully for the last 6 months, and I request for 100,000, because I have a history, I will get that. So I think it's incredible. Now you have, people who were not bankable before participating in this space because of that innovation by the telecoms, but also government providing the opportunity. There's opportunity for us to innovate in the medical, or I would say the health space. Right now we have medical insurance. During COVID, we saw a lot of government people or government staff or employees even paying for medical insurance because government doesn't pay medical insurance, or some parastatals don't, or some ministries don't. So people were paying from their pockets for medical insurance because it was very, very important. And that has caught on. So the health sector grew or blossomed during COVID, whereas everyone else was struggling. But I think people got to appreciate the importance of having medical insurance. How do we then translate that to the muntu wa bulijjo and make sure they also have an insurance package they can afford? That requires being innovative. How do we ensure that the medical insurance package is not exclusive to the married who are employed by a corporate or private sector entity that is registered? How do we democratize medical insurance so that even I, as a boda guy who is single, or me as a salon hairdresser who is making my money, or as someone who is running my boutique but makes my money, can afford to pay 350,000 per month, and I know that I will go each time I'm sick. I can go to these hospitals and get free medication. Yeah, it's possible because we're paying about 780,000 for a family to get medical cover. So why can't we get that package for a single person, for example? And that would be transformational.